what treatment would you choose if the progression-free interval was less than 6 months? I'm getting to a tough to treat group here. And what if the patient was BRCA wild type and HR-proficient or HRP? Anybody want to take a stab at that one?
I mean, I think for so-called platinum-resistant disease, which, you know, certainly we're moving away from that and looking at just what the platinum pre-interval is, but anything less than 6 months, I definitely would move on from platinum and pursue probably something consistent with Aurelia, so chemotherapy with bevacizumab. And, you know, certainly I like to use weekly paclitaxel quite a bit here. I think that we get a lot of activity, but also pegylated liposomal doxorubicin or topotecan, even gemcitabine, very reasonable in combination with bevacizumab.
Yeah, I completely agree with that. I think platinum sensitivity is a biomarker for PARP sensitivity. So to me, probably would have moved into bevacizumab for sure and other chemotherapy combinations.
Or a clinical trial, right, Tom?
Clinical trial. Correct answer, Dr. Weston.
And then, you know, I think with if the patient was wild type and HR proficient, I mean, if it's the platinum free interval less than 6 months, that's the same answer. I think that if it's for our prior patient who had, you know, previously received, was in a secondary maintenance setting after response to a platinum-based therapy, I mean, I think, you know, you can still use a PARP inhibitor in that patient population, but again, just like up front, you got to be mindful of what your benefit's going to be and make sure they know that too.
And I definitely would not do surgery. This would be palliation.
That's right.
So
That's right.
since I said I would do secondary debulking, I would rescind that comment at this point.
All right. So Shannon touched on this, the really a trial guiding how she may approach this patient. This trial assessed Bev in combo with various chemotherapies, liposomal doxorubicin, weekly Taxol or topotecan, versus chemotherapy alone in platinum-resistant ovarian cancer. So for patients receiving the Bev versus Bev with chemo combo, the primary endpoint being progression-free survival was 6.7 months versus 3.4 months. The median overall survival was 16.6 with the Bev arm versus 13, I think it was, in the chemo alone arm. So a progression-free survival benefit, again, tough to meet that overall survival threshold. And this is just an exploratory analysis demonstrating the difference between arms, but based on this trial, all are reasonable alternatives for this difficult to treat scenario. And I think you tailor the chemo plus Bev, which cytotoxic you're going to use based on the patient's performance status and things like that more so. I don't intend this slide to say that Taxol is better than the others. It was not. This is an exploratory. So I think you need to take this with some degree of, with a large degree of which cytotoxic is the patient going to tolerate best in this palliative setting.